Both the physician and the nurse ask closed-ended questions to gather basic information about the client. The physician asks open-ended questions that shows effort, care, and respect on their side, and it also shows therapeutic communication. There were good proxemics. Both the nurse and the physician were at personal, however not intimate, distance. This shows boundaries and respect towards the patient. Both the physician and the nurse knocked before entering the room. Again, this shows respect towards the patient while protecting their dignity as well. The physician also introduced herself to the patient and asked her questions such as how her day has been going. This builds respect and trust between the patient and healthcare professional. This is also necessary to achieve therapeutic communication goals. The nurse followed the physician and performed hand hygiene when entering the room at the end of the video. This creates a sense of comfort for the patient, in turn creating trust.
Physician was patient with the client. This is a vital form for forming trust that with the client for achieving therapeutic communication. Physician was understanding. The physician used proper hand washing. This may not seem like a part of the communication process, however, it forms trust with the patient. The nurse advised consequences if the patient did not take her medication. The nurse and the physician both kept eye contact while speaking. This is very important as well, as it shows the patient that you care, are interested in what they have to say, and builds trust.
The physician checked the patient's identifiers, her date of birth, and name. This is vital because it assures that you are speaking with the correct patient. This is important to protect patient confidentiality and patient dignity. The physician showed care and empathy for the patient. This is again vital to gain trust, and it is an important role as a healthcare professional. The physician engaged with the patient and validated her feelings. This is crucial to have any sort of communication goal achieved, and as well to gain trust with your patient. The nurse gave her some space when the patient made it clear that she was not comfortable with taking the medication. This sets boundaries and earns trust. The physician was not judgmental and listened to what was bothering Mrs. Jones. This makes the patient feel understood and cared for, rather than getting upset or angry with her when she states what is bothering her.
The nurse did not practice therapeutic communication, as the goal was not to provide optimal health to the patient. It was to get in and get out and move on to the next client. The nurse also did not tell the client what the medication that she was going to be taking was for. This creates another barrier for effective communication because the patient is unaware of your goal as a healthcare professional. The physician and the nurse did not close the curtain. Again, this creates a barrier for therapeutic communication and for trust, as it does not protect the patient's dignity. The physician told Mrs. Jones her husband would be coming to visit if she took her medication. This creates a barrier to therapeutic communication as well as trust because it is false reassurance. The nurse did not use nonverbal communication and did not have a good body language, whereas the physician tilted and nodded her head to show interest in what the patient had to say. Not practicing good body language can make you seem unapproachable in the patient's point of view and can become a barrier for effective and therapeutic communication.
The nurse did not introduce herself to the client. That can be a barrier for both effective and therapeutic communication, as it can cut all chances of trust being formed between the nurse and the client. The nurse did not check her identifiers, again, barrier to effective communication because she may not be relying confidential information to the correct patient, as it is an improper procedure. The nurse did not perform proper hand hygiene when first entering the room. This can be a barrier to gaining trust with the patient, and it can also make our patient uncomfortable. It prevents therapeutic communication as it acts as a barrier to the goal of optimal health for our client. The nurse did not introduce herself to the patient. Again, this is a huge barrier to that trust that is needed to therapeutic and effective communication. The nurse that left the patient unsupervised when taking meds, this shows incompetency.
The nurse was not understanding, nor did she have patience with the client. This is a barrier to the trust that needs to be gained in order to achieve therapeutic and effective communication. The nurse gave up easily on the client. This also shows incompetency on the nurse's behalf. The nurse did not ask many open-ended questions. This creates barrier to that therapeutic goal because the nurse is not making an effort to understand and help the patient. The nurse had an RBF and did not smile. She wasn't really friendly at all. This makes the nurse seem unapproachable and becomes a barrier for therapeutic communication and optimal health for a patient. The nurse did not leave the call bell in reach. This is a barrier to effective communication because the patient cannot reach the nurse when they need her.